Dr. Chaves, in your practice you deal with lots of people, young and old, right? So you basically have a really a general practice which encompasses just about everything, or everything actually. So tell me, however, in specific about children. You know, young children, what should moms take care of? What should they do before, after pregnancy, and as the child grows up to go, you know, get the second teeth and even thereafter?
Sure. Well, you brought up pregnancy. While a lady is pregnant, ideally she should make sure that she comes to the dentist probably every 3 months, just because there's an increased inflammation in the gums. And it's very, very important during gestation, during your pregnancy, not to have inflammation of the mouth.
And you're saying that while a lady is pregnant, the tendency of having inflammation in the mouth is higher?
Yes, much higher, because the hormones change. And so, bless you. So this would be something that would be very useful for a woman to be very attentive to the health and condition of her gums. Once a child is born, what I like to do is have the mother bring the child with her or with the father every time they come in for a cleaning. So the child becomes acclimated to the environment. We will introduce the child to all our different little toys, Mr. Wetty and Mr. Air, and they'll go up and down in the chair, you know, those kind of things. And we have balloons and toys, and we create an environment that is fun, relaxed, and we make a fuss about the children. So when the child is 3, and this is usually the age I like to begin to actually treat the child as a patient, the child is already a friend of the practice. This is a fun place. They already know me, and we take it from there.
Right. So you get them used to it. You know, so it's not like the first time they go to a dentist, mom says, "Well, be brave today because we're going somewhere where it's going to hurt." And, and then the next thing the next thing the child sees is a speed thriller in front of his face.
That's correct.
Yeah.
You know, children really are blank slates, and we impart to them our fears and preconceived ideas. So when a parent will refer to the child that comes to there and says, "Don't worry, Bobby, it's not going to hurt much," boy, that's a big flag.
Yeah.
So it's we got to be very careful, because we will many times pass on our fears to our children.
Right.
So if you're just a little careful with your verbiage, bring your child in, and ideally, actually, love to have the child sitting right on mom's lap. Mother's being treated, and the child's right there watching TV, hanging out, feeling what the mother's feeling almost. Mm-hmm. You know, hearing the sounds that the mother's hearing, the suction and the etc.
Maybe playing with the mirror, doing things.
Absolutely.
Maybe even looking in mom's mouth.
Oh, all of the above.
Yeah.
It just creates an environment that the child becomes acclimated and is non-threatened.
Good. Now let's go to the child starting having the teeth. What should mom take care of there? You know, I hear lots of stories about, you know, some children have much more open mouths by the time of 6 than other ones, and it's not genetic. It's just apparently something the parents do or don't do.
Yes. Well, a parent should attempt to brush their kid's mouth at least twice a day minimum, and teach them to floss. This is really important. The habits that your children learn in the early years usually carry through the rest of their lives. So if you're rigorous enough and disciplined enough to teach your child certain basic habits, and bring them to the dentist from an early age regularly, and make sure that every encounter that your child has with the dentist is a positive one. And here you may have to be the cop. If you're sensing that you know, your child may have 3 fillings, and the first filling is going kind of rough for whatever reason, you as a parent should maybe take the dentist aside and end that meeting that day with just that 1 filling. You don't want to compound the encounter and make it worse and worse, because then that'll become an insurmountable mountain, become much harder next time to bring your child in. Right. So if you're sensing it's not going well, try end it. Make it diffuse the energy, make it seem as pleasant as possible, and then maybe give it a good month, And next time they comes, we make sure the child had a good night's rest, hasn't had too much sugar, and we go with a smiley face, and we gingerly go ease back in. That's how you build a child's confidence and acceptance of dental work.
Right. So now let's go to, so in order to not to perhaps get those three fillings, not that fillings can be avoided, not that,
Yes.
you know, no doctor and no good habits in people 100% avoids everything. That's not
Sure.
the point. But we
Absolutely.
can diffuse the risk. So what can parents do? Like, for instance, you said something about sugar, and I heard about the bottle syndrome having to do with sugar.
Yes.
Explain that. You said something about it at the beginning of camera.
Yes. You know, unfortunately, some parents, I think this is happening less and less, will take a bottle of apple juice, for instance, and lay their child to sleep with a bottle of apple juice. Well, this will rot out the teeth. Same thing with milk. You know, you think that milk is good, and it is. But milk has lactose. Lactose is a sugar which breaks down into an acid that demineralizes the teeth and forms cavities. So it's really important that the last thing that enters that child's mouth before they go to sleep be a toothbrush and some water, and just keep it neutral, and no foodstuffs, no sugars, because they will just rot your teeth.
Got it.
Yeah.
Now, is the thumb sucking in any shape and form a problem? Is it really, you know, some people say it is, and other people say it isn't. What's your viewpoint?
My point of view, almost every child will thumb suck to some degree. It seems to be just one of those human traits that we tend to do. Some of us transition much more quickly from that behavior pattern. You don't want it to linger. If you let it prolong, it could deform the maxilla and cause you other orthodontic related and even structural related issues. But so the key is not to be alarmed if your child does thumb suck early on in transition, but then transition him or her out from that as quickly as possible. You don't want him to be, 3 years old and sucking his thumb. That's completely...
Okay. I'm glad you put a time frame, because,
No,
sometimes
and the sooner
early
the
means
better.
what? You know what I mean? It's like means 7, means 4, means... So 3 years is about, kind of like it should be...
Actually, if you can do it much sooner than that, it'll be even better. Don't be alarmed if they do it. That's normal. Transition them out.
Yeah, good.
Okay.
Because it can
Absolutely.
make your teeth crooked, pull them forwards or something, whatever it is you do with the kid does.
Absolutely. Remember, in that young age, they're very malleable. They don't really, their bones are more like just hard cartilage.
Right.
And it doesn't take much force to actually deform them. They're like Play-Doh at that stage.
Yeah, I can see that. All right, now, as then a child grows and the transition comes from the first teeth to the second teeth,
Correct.
Shed some light on it, because my father used to pull teeth out on me with a little string, or he just took it with the finger, and I'm not even sure whether I'm imagining it or not, but I think he took a plier once. He is after all a mechanical engineer. And the basic attitude I remember was this: those teeth come out anyway. Why bother about saving them? Why bother about getting drilled, which, especially in my time, still might have hurt a little bit. It's not advanced like now, and most likely it costs some money.
Yes.
So all of the above. However, how much do parents have to really take care of the first teeth and keep them tipped up, even though they come out?
For two basic reasons. The first reason is if you don't keep them in good repair, your child may develop an abscess. That's painful, it's not fun, and it can be problematic for your child, and you'd like to avoid that at all costs. And the other one is if they lose a tooth prematurely and you don't hold the space with the space maintainer, you run the risk of them having compounded orthodontic problems later on. So save yourself some money, save yourself some drama. Just keep them in good repair.
And save the child some drama, I suppose.
Absolutely.
Right? On that note, do you, seeing all those people, and from literally movie stars and top-rated basketball players and all those type of things, all the way down to children who will be all the above, right? Do you see them to be conscious about not health, because that's below the understanding, I suppose, but good looking? Kind of, does a 7, 8, 12-year-old child, 14-year-old child kind of pay attention to and gets nicked in school for having a a hole in it and all that stuff? Yes or no? Are they self-conscious about it?
Yes, it's unbelievable. Kids nowadays are becoming very self-conscious, and they're developing image problems, unfortunately, a lot sooner than they used to. And you'll get 7, 8-year-olds who will be very concerned about the fact that they have one front tooth that is slow in developing and growing, and you know, they want to come in and have us bond something to it, which is totally, you know, something that we wouldn't want to do. But in any case, they're becoming much more conscious about their looks. Absolutely.
Yeah, because it's out there, obviously, right? It's
Sure.
This image building with pictures and with videos is so out there, so they become aware of it, right?
Correct.
So they all become little Shearies. What's Tom Cruise's girl called, which apparently is very fashion.
Are you talking about Nicole Kidman, or
no, the other one, the one Tom Cruise has with his.
I forget.
You know, anyway, the little girl apparently.
Yeah,
she
yeah,
apparently has high skill, and she.
Oh,
you know,
yes, yes.
She's princess.
Yes, yes.
And yeah,
Sherry, I think.
something like that. But you know, most children, it true is, most children run around at the age of 3 having mommy's high skill, heel, and want to be good. So this is important. So parents should realize that also, that they're putting hardship on their kids, not maintaining their good looks in their mouth.
Correct.
Good. Anything else you think parents should know?
No, just bringing your children on regular checkups, and try and always create an environment of, this is going to be fun. Right. Oh, we got a treat today. We're going to the dentist. You know, if you talk in those terms, you pass on that energy to your child. Their expectations will be a favorable one.
Thanks, Dr. Chaves.
You're welcome.